My name is Amber David. I'm a student physical therapist with the University of St. Augustine, and this video is about the movement summit that the APTA had, where they invited 100 different physical therapists from across the country and all different methods and techniques that they may use, and they brought them together for collaborative sessions on how to implement the APTA's newest vision statement, which is to transform society by optimizing movement to improve the human experience. And what does that mean, and where do we go? And so to start off with, we need to say, well, why do physical therapists, or how do we fit in there? And so we fit in because we are the movement system experts, and that needs to be our identity. And that is what the APTA's goal is for the physical therapist to have a united and undivided definition so that everyone sees us in the same way. And it's no longer, well, I do ortho, or I do neuro, or I do women's health, or I do all these various tools and techniques and manual massage, which are all great and we learn them and they are valuable. However, as a physical therapist, our identity needs to be set in we are movement system experts. And so, well, what's the movement system? Our movement system is our bodies, and in order for our bodies to move, it requires multiple different structures and not equations, but chemical reactions and different things happening in our bodies, and multiple things that people don't even think about. But it takes our lungs, we need oxygen. It takes our brain telling our muscles to move. It takes our muscles. It takes our nervous system. It takes our heart. All of these different components come together, and that's how we move. And therefore, it's our movement system, our body. And as physical therapists, we need to look at that movement system and say, how can we make it better? If there's pain, is it because we're moving in a way that our bodies shouldn't move, or is it normal for us? And so this identity that the APTA has for us from this vision will help not only physical therapists be undivided, it's going to help society, because there will be less muddy waters when it comes to, well, what makes you unique from an athletic trainer? How are you different than a massage therapist? Or why should I see a physical therapist instead of a chiropractor? And this comes down to insurance companies when they say, well, why should I pay for my client to see a skilled physical therapist? What does it mean to be a skilled physical therapist? And for when doctors, when they refer a patient to physical therapy, they'll say, well, I know you need physical therapy because they are the movement system experts, and your problem or your dysfunction is with how you're moving. Or a person who's told they need physical therapy and maybe they don't think they do and they don't see the benefit, it can have a common definition with society, with healthcare professionals, and just across the country saying physical therapists are the movement system experts. And how does that start? Where do we implement that? So physical therapists, we implement that starting at the very beginning of our patient-client relationship with our patient care management model and our examination. In our examination, we need to look at how they move. If there's pain from a movement, we need to look at that movement. We can look at it in different angles using different tools and say from the side, from behind, from in front. Is their shoulder too low? Is it too high? Is posture off? Is there a hip hike? Is there something going on in the foot? There are various different things that can be happening, and that can be related to what's causing pain. Or maybe it's not pain, maybe they want to get better at something. In order to do that, they need to enhance their movement. Their movement needs to be the best that it can be. So we are going to examine that, and then we're going to evaluate, taking all of this analysis of the movement they've done, and we're going to come to a diagnosis related to the movement. And from there, we can make a prognosis saying, well, this is the movement dysfunction, but we have a great prognosis that they are going to have a wonderful result with so many physical therapy skilled interventions focusing on this movement dysfunction and fixing movement. And so, in order to do that, going to an examination process, we need to look at activities that people do in daily life, starting with a young child all the way through our senior citizens. Everyone, almost everyone in the morning wakes up and we sit up and then we stand up. So, we need to look at things like sit to stands. We need to look at walking or maybe quiet walking. We also can look at going up steps and a step up. Most people will encounter these activities every day. And so, if we can make these movements the best that they can be for that person, then they can go ahead and they can continue to have the best quality of life that they can have because they're no longer hindered by their movement and their movement can be enhanced. And this goes full circle back to the APTA's vision statement of transforming society by optimizing movement to improve the human experience. We can take our patients and across the world and across the country, that'll mean our society, and we can take their movements and we can make them better. And then hopefully their pain will go away, and hopefully they can accomplish tasks that they might have been concerned to try because they were worried that their bodies wouldn't be able to do it. And they can reach goals all because we have helped their bodies move that in the best way possible for them. Thank you for watching.